Okay, good afternoon, everyone. Thank you for joining us today for our Host Home Provider Stakeholder Meeting. My name is Meg Yanaba. I am an HCBS Benefits Supervisor here at the department, and along with some of our work group members, as well as the assistants of Mission Analytics, we will be presenting on the House Bill 23-1197 Host Home Provider Oversight Project and our progress thus far on the project's goals. Please make sure if you do have any questions, please put them into the chat so that we do have a recording of your questions. Thank you. So our mission here at HCPF is to improve healthcare equity, access, and outcomes for people we serve while saving Coloradans money on healthcare and driving value for Colorado. Today's goals, we'll be presenting on the progress from House Bill 23-1197, the Host Home Provider Oversight Project. We'll engage in constructive conversations and feedback regarding the project's goals and next steps. And then at the end, we'll evaluate whether or not there's a need for additional meetings.
There weren't many left, though.
So the first thing to go over is the project's goals. House Bill 23-1197 set out for the department to address three primary goals of this project. The first one is to assess the timeline, process, and procedure for reporting a grievance or complaint about a host home provider or agency. The second goal was to determine the process by which a host home provider is convicted of abuse or neglect, is made ineligible to provide services. And finally, to evaluate the consistency of contract language between provider agencies and host home providers. First, reaching to the grievance and dispute process. Over the last couple of weeks, we've asked for Mission Analytics, as well as our team and our work groups to evaluate what the process is for providing feedback and complaints and grievances about a host home provider or agency. In this project, we captured APS, Adult Protective Services, law enforcement, HCPF, the Department of Public Health and Environment, case management agencies, and provider agencies. One of the big things that we looked at is the regulations and specifically what they state for each of those entities as far as what is included in a grievance, how to file, and what is the responsibility of the applicable entity to verify that information and investigate the grievance. What we've found is that the biggest hurdle that we are looking at and the biggest project in this is really closing the gap of communication between entities. That may be between HCPF and the case management agency, APS, law enforcement, who's providing what information and how is that information being shared to make sure that all aspects of the grievance or dispute are being addressed. We also looked at the possibility of initiating a formalized whistleblower policy. Oh, I apologize. I am not in slideshow view. There we go. That's a little bit better. So as I was saying, we looked at formalizing a whistleblower policy to mitigate any type of retaliation towards a reporter of a grievance or dispute. And Catherine, I believe you are on the call. Is that correct?
Yes, I am.
Catherine, could you give us a little bit of an insight of what you found during your research for looking at grievance and dispute policies for stakeholders, what we ask Mission to do is really look at it from a stakeholder perspective. As a member receiving services or a family member that is filing a grievance, what was their experience? So Catherine, can you give us an overshot of what that looked like?
Sure, I can do a real brief update. I wasn't really prepared to speak on this now, but I will. It's kind of all over the map, in that it's really difficult, I think, we're finding for individuals and families in particular to know how to and when and under what circumstances to reach out to the different agencies. And so I think that's the main upshot of that, was just there's lots of different ways to get to the same kind of point of view. And I think it's just trying to figure out what would be the best ways forward.
Thank you.
Mm-hmm.
So I'm going to go back here. Before moving on, Jody Walters, I'm wondering if you can kind of speak as to what your experience may be or what your takeaway was from this specific goal in researching this.
The grievance and dispute process specifically?
Yes, I know you've had several positions within the field, and are there specifically things that you think the work group needs to focus on just to make sure that this is a streamlined process and really meets the needs of the members and stakeholders?
Yeah, I mean, of course, I definitely think that I think that the providers themselves need an opportunity for due process. And so that is really important within this framework and what that looks like, how information is entered into any sort of a system, who has the opportunity to sort of check that information to ensure that it is factual, and who has access to it, so that we are not, as a system, engaged in anything potentially slanderous or anything along those lines. But how do we also protect the individuals that we are all here really to support, and ensure that they have maybe some of those instances that haven't kind of quite risen up to that APS, where they're being captured in APS or the criminal justice system, that we can be able to ensure that there is a way to connect those dots and to report back out. And, you know, it's a little bit tricky to ensure that we are both straddling that line between protecting the legal rights of providers and protecting the health and safety of the individuals that we are all here on this call interested in doing that for. So those are really that's the broad base kind of brushstrokes that we need to ensure that we are keeping in mind. And I don't know if that's exactly what you were looking for, if you want more details on specific things that were talked about in our subcommittee, but yeah, that's the broad brushstroke.
Thank you. I appreciate that. I know we have spoken quite a bit to how we ensure due process throughout this whole process for providers, and really just the big communication aspect, sharing information to make sure that we are aware of situations that could be endangering the safety of individuals, and how do we move forward to make sure that all of those boxes are being checked. And Julie, I do see that you have a question with what about legal rights of employees and contractors? Can you send us statutes you are worried about? Thank you for this, Julie. We will be taking note of all questions being asked. We can follow up with you and the stakeholders as a whole regarding those statutes that we will be looking closer at. So I appreciate your comment. Moving on to the second aspect of the project, and possibly the biggest aspect of this project that we've really been focusing on is a host home provider database. This addresses goal number 2 of how to track providers that have been convicted of substantiated abuse or neglect, and how do we prevent them from continuing unethical behavior in this field. So we asked Mission Analytics, our vendor contractor, to look at a database to track host home providers and keep information to hold them accountable. Information that we have talked about having included in this database would include potentially the trainings that the providers have taken part of, as well as if there are any allegations against them that have been substantiated that need to be made aware of prior to placing someone within a home. We talked about how to identify these individuals. Historically, there have been situations where a provider may go by different names. They may be over different homes instead of just one home. How do we keep that information consolidated and organized in an accessible way to be able to make sure that any unethical behavior is being caught in a timely manner? During this process, we also discussed who will have access to this. Will this be specifically run and maintained by HCPF or in coordination with other agencies as well, such as CMAs, provider agencies, law enforcement, and CDPHE? Will they have the ability to access it externally? Will they have the ability to make changes to the database, enter in information, validate information, and what type of access will providers themselves have? In this process, we have been looking very deeply with a fine-tooth comb at the credentialing of providers, of provider agencies, and who will have the ability to make those changes, but also what are the legal requirements here? We're looking at not only making sure we don't violate any HIPAA requirements, but also with the due process, not putting in information that is not verifiable and does not put anyone at risk of harm by providing information regarding the members or specific information that could be used against a provider, such as a social security number or things like that, things that as an individual you wouldn't want out there. But that also being said, making sure that we are capturing if there are any potentially unsafe situations with a host home provider, with the setting, that those are being captured accurately and really holding the providers accountable. Going on to how will the database be utilized amongst all groups? Should there be a provider rating system incorporated? Whether or not this is kind of like a 5-star rating based on their experience and their affiliations with previous providers and current provider agencies. How likely would someone be to, or an agency be to rehire an individual if they were a previous employee? How do we also capture providers that may be considered bad actors and prevent them from jumping from agency to agency? This is really a big part of this database to kind of prevent that hopping and the bad behavior spreading. And would PASAs and host home providers want this database to house information such as background checks, applications, etc.? For the background checks, this could be beneficial if a new host home provider is starting and they're potentially applying with several different agencies. They don't have anyone in the home yet, but they would like to widen their possibilities of having someone in the home. Can background checks be stored within a database to prevent numerous background checks having to be run all at the same time? Okay, I see some comments and questions in the chat. First, we have from Kathy. It is unclear to me, though, whether this is a clear understanding of what host home provider is responsible for. I do not believe everyone is on the same page, especially when someone is placed in crisis. One cannot critique, improve, or report if it is not clear what the host home provider is going to provide. Yes, thank you, Kathy. We have talked in depth also about with this database and kind of a provider rating system, the possibility of also including for case management agencies and provider agencies, their experience. What is a provider potentially looking for in a member receiving services? What can they realistically accommodate and provide? Is their home ADA accessible? Do they have specialized medical training? Things like that. So I hope that answers your question. Julie has, oh, I'm skipping some. So Madeline, I'm sorry if I missed this, but how is this different than the CAPS check system? The CAPS system is where substantiated main is currently supposed to be logged, and we are required to check that database prior to hiring or contracting with a provider. Thank you for that, Madeline. Some of the things that may be captured in a CAPS check may not be all indicators of potentially unethical behavior. Some examples of this may be, as I stated, a provider using two different names. We have experienced this in the past where a host home provider is listed at one home with their married name and another home with their maiden name. That may be something that is not captured in a CAPS check, but that is definitely something that could risk the safety of an individual if the ability to provide 24-hour supervision is not able to be met because of such situations. Other things that may be included in this may be if there are histories of aggressive or confrontational behavior that wouldn't necessarily fall under something that is captured in a CAPS check. It's not something that's reported to APS, but can be difficult behavior and unwanted behavior from a person providing services. So that's a small snapshot of things that may be captured, but there's a very wide list of what could be potentially covered in this. Julie had stated, aren't most, if not all, host home providers contractors, not employees? That is correct. Yes. In most cases, we do see in the past couple of years, there has been a shift from having host home providers as employees to independent contractors. Stephanie, PASAs run the CAPS checks and the background checks, but it doesn't seem to stop them from contracting with them if something negative pops up. Yes, we also see this as well. One of the things that we have talked about as far as the regulation side of things with this database and how to really incorporate it and make sure that it is maintained in the way that it is supposed to be maintained. It is used for the purpose that we are asking, is to evaluate whether or not the state of Colorado comes up with a minimum standards type of checklist. This may state in finer detail what would be a disqualifying ding on a background or CAPS check. CAPS checks right now in the regulations do have a bit more strict and black and white language of what is allowable. But when it comes to the background check, it's a little bit more fluid, and it is currently left up to the provider agencies. So we have looked at whether or not that needs to have some revisions to it or some stipulations that states this is not an offense or a level of an offense that we are willing to accommodate in the state of Colorado. We haven't determined anything thus far as a list goes with that, but it has been part of conversations. Pat, I'm hopeful that this work will continue so that the accountability of host home providers, PASAs, and HCPF can be improved. We agree. It seems that individuals with disabilities and their families have been unintentionally precluded from participating in this process. As family members, we want to know who is monitoring what happens in host homes and that this monitoring is happening frequently, not once a year or even once a quarter. How can individuals and their family be protected if the process or if that cut off? If they report wrongdoing? What training is required of host home providers? How can this be improved? Should certification and annual renewal be required? Who is responsible for the quality of life of the individuals in the host home? Pat, you hit it right there on the head of the nail. This is, in summary, exactly what we are trying to do with this project. We're trying to firm up who is responsible for what type of monitoring, what does that include, and the frequency. How do we improve that frequency and the communication to make sure that we are not letting anything slip through the cracks? So I hope that through this process, we are addressing all of those things. It's definitely the intention of this House bill and this process in whole. Joshua, the purpose of the background check is not just in the moment check, but also notification down the road of crimes to the agency if they are committed. That's not realistic safeguard saving checks. You're correct. In most cases, background checks are really only run at the point in time that an individual is being considered for employment with an agency, whether that is an employee or an independent contractor. There is not necessarily a stipulation or a way of verifying that if there is a offense, whether it's on a DMV check or in a background check that may not be made aware to a provider agency, that the independent contractor or the employee is initiating another background check. So how do we go about double checking those things? And do we need to set a term limit on a background check that it does need to be done within another 3 years, 5 years, or what have you? So we are looking at that as well. All right, I am going to move on. I know that there's a lot of questions. As I said, there are, I do have my staff that are monitoring this chat. They are keeping track of the questions and will be following up with them. Okay, so responsibilities for data entry. Who's responsible for inputting data into the database? We've had several conversations about how this will be managed and who will be responsible for what. We are in the process with this database. It is in the very, very beginning stages. We don't have all of the pathways and bugs and barriers and everything that we want captured in it formulated exactly yet. But this has been a big part of that. So is the case management agency responsible for entering in information regarding APS compliance or law enforcement involvement that they receive from critical incident reports? Is the provider agency responsible for inputting updated training information, background check information, or specifically even onboarding and offboarding information so that we are aware of timeframes that an independent contractor, a host and provider is working with applicable agencies. And what is with that process, what is the backside process of verifying and maintaining that information? Who is in charge for what? So we are stipulating that within our guidelines while we are developing this process. Is there a third-party reviewer needed? This is something that we have looked into due to the due process and the legal implications of such a database. We are working very closely with the Attorney General's office to make sure that prior to the launch of any such database, we are honoring due process for a provider so that potentially fraudulent and damaging information is not being put onto a database without the possibility for further explanation or verification from the provider and the responsible entities. We have kind of mentioned we are looking at how often providers should update the information. Right now, the expectation is that information is updated within a reasonable bound of time, depending on the severity of the situation or the information being provided. For critical incident reports and those types of things, we are requiring those to be done within 24 hours. However, if we are asking to have training information updated in here or onboarding, offboarding, we do need to look at extending that. We understand that anybody involved in this process does have other things on their plate to be having to deal with. So allowing for an appropriate amount of time for any of these situations to have that information updated will be evaluated and set forth pending the implementation of a process like this. And what would be the best way to generate credentials for host and providers and provider agencies? We have talked about with the capabilities of the system that we are assessing whether or not there will be room for information or documents to be uploaded, such as training certificates, things like that. So all things that we are looking at implementing with a potential provider database. Streamlining and maintenance of the database. Thoughts on how to maintain the database and the data to ensure information is current and up to date. We've talked about the complexities of those requirements and how would we dictate those requirements to provider agencies and CMAs, and at the department level and the state level, who would be in charge of maintaining that data and in charge of data cleanup in areas where there may be duplications or typos, anything like that. Who would be in charge of maintaining that? Part of removing those duplications is also removing the duplication of efforts of the Division of Local Affairs, CDPHE, and HIGPUF in maintaining separate PASA lists. As some of you may know, there are several PASA lists, whether it is on the Find a Provider webpage within the system, or if it's a printable provider database that is often given out to members during annual service plan meetings. How do we make sure that we have one clear and concise list, and how is that being maintained? That is part of this process. With that data cleanup, one of the things that we are seeing within the Division of Local Affairs database is that the information being put into the system is the best information that we have. In some cases, there may be duplications of listings or provider entries that we are looking at trying to streamline with things such as an address verification. For the DOLA database, one of the conversations we've had fairly frequently is that there may be a provider within that database that is listed 3 different ways because of the address, whether the address is spelled out, say it's 123 North Street. Is it 123 NST, North ST, North Street, and so on and so forth. So we see a lot of variations with that. That's something that we're continuously working on all ends, but looking at using an address verification system, specifically within this database, to help mitigate some of that extra work. Okay. Standardized contract language. This is the 3rd goal of this program. So currently with the regulations under the Colorado Code of Regulations, there are some stipulations of what should be included in a provider's contract and policies and procedures. Some of these things include the grievance and dispute process. This needs to be dictated and sent out or at least communicated with members receiving services, their appropriate legal authorities, and with employees. Some of the other things that are included in there that we require to be in there is the requirement for main training, incident report training, things like that. However, with the regulations right now, there is a lot of room for provider agencies to be able to add in additional information that is relevant to their agency as a whole. What we have talked about is whether or not those regulations need to be a little bit more defined. They need to have a clearer expectation. And is there a need or a desire to develop templates for these? This is something that we're often asked by incoming agencies, that is there a template or is there a specific language that needs to be in my policies and procedures? So we're looking at whether or not that is something that is an identified need for stakeholders, and whether or not it is appropriate for HCPF to develop those templates. When it comes to incident reporting, this is really one of the biggest areas that we have seen the most amount of creativity and deviation from what would be considered a standard rule of thumb. We understand that in a lot of ways, incident reporting and how it is formatted, what information is captured, can be depending on the system being used. I am aware that several agencies use TheraP as a documentation system, and they have a very solid and standard incident report form and process for doing the general events reports. But every PASA, every provider is able to use whatever kind of system they see fit. So that incident reporting can vary. And do we need to develop a template that captures all of the information that we would expect to see in an incident report, maybe gives further instruction into what detail is expected of these reports, to try and minimize the amount of back and forth communication and information seeking that happens post-incident. This would help to streamline the process and also ensure that the information is consistent as to what is being provided. Right now, there is a formalized template for critical incident reports, but as I said, we are looking at potentially doing a template for regular incident reporting, not something that is considered critical. Okay, now I know there's still a lot of questions in the chat, so I am going to address those. We have roughly about 20 minutes left. Okay, let me find where I was at here. So I apologize, Kathy, that I did not answer your question fully. There is physical and sexual abuse. There is neglect, and there are such things as really lousy food, lack of meaningful activity, basically doing the minimum. We need a clear job description for host home providers, minimum standards, best practices to follow, and then some sort of standard contract that can be modified based on the service plan. Agreed. So as you mentioned, those are the lousy food, lack of meaningful activity, the doing the bare minimum. Those are things that are not captured in a background check or a CAPS check. And how do we make sure that we are holding all providers, all host home providers, to the standard that we wish to see here in Colorado? Deanne, APS opens cases on a small percentage of intakes, so many host home providers are never investigated or put on the CAPS list, but they have caused harm to a person in their home. I understand this. Stephanie, are you on the call?
Stephanie isn't, but I'm sitting in for her.
Oh, wonderful, Kathleen. Thank you for joining us today. I'll kind of give a little recap. We talked about this during the grievance and dispute conversation with the work group about what is considered something that moves on towards investigation in the APS world. And I'll have to admit that you know a lot more about APS's process with this. Maybe you can share a little bit about specifically what would be criteria identified that would move forward with an investigation and under APS.
Sure, I can give kind of like the quick version of all of that. So there are 2 criteria that are required for APS to become involved and actually investigate, and that's required by statute. The first is that there has to be an allegation that fits in one of our definitions of mistreatment or self-neglect. So mistreatment in APS includes caretaker neglect, exploitation, financial or otherwise, sexual abuse, physical abuse, and a harmful act as well. And harmful act is a little bit sort of nebulous. It's a newer definition to kind of capture the things that are harmful to somebody but don't necessarily fit in neatly to one of the other mistreatment definitions. And then self-neglect obviously would be, somebody substantially endangering their health, safety, and welfare because they're not meeting their needs. So we have to have an allegation that sort of fits into one of those little buckets or one of those definitions, or appears to anyway. And then the other criteria is that they have to be an at-risk adult per our definition. And so we do recognize that there is some overlap with mandatory reporting definitions. Those, I just want to be clear, are in the criminal code. Those are in Title 18 because mandatory reporting is required to go to law enforcement for adults. So their definitions of who is at risk differs from what APS's definition, which our definition is in Title 26 of the revised statutes. So with mandatory reporting, that involves anybody age 70 or older, or anyone with an intellectual or developmental disability who's 18 and over. Our definition in APS is based very much on a person's ability, their functional ability, their decisional ability, that kind of thing. So APS's definition doesn't have any sort of like clear cut, if they're 70 and over, we accept it. Or, if they have a specific diagnosis, then we accept it. It really does just sort of vary based on what that person's abilities are. Can they protect themselves? Can they take care of themselves? Can they meet their own needs? Those kinds of things. So any information, when you're making a report, any information that you can provide that sort of paints a better picture versus just like, here's a list of diagnoses this person has, that is really helpful for counties to kind of understand, does that person actually meet our definition of an at-risk adult, or likely meet our definition of an at-risk adult? Because it can be really hard to go off of just like a list of diagnoses if we don't know how those diagnoses impact somebody. Because, dementia, for example, looks very different at various stages, and also looks different based on what type of dementia you have, that kind of thing. So same with folks who are on the spectrum, or folks with intellectual and developmental disabilities. It varies. People's abilities vary. And so any information that you can provide at the point of intake with that is really helpful to kind of help paint that picture a little more robustly so that we can make a better decision, or make a clearer decision at least. Hopefully that helps.
Thank you, Kathleen. I really appreciate it.
Of course.
So addressing some other comments within the comment section. Joshua, what I have asked for is clear person-centered language in service plans regarding the support a person needs and the agreement for the PASA/provider will provide. Sufficient case managers to monitor and support members with their services, training for PASAs and providers on a member's needs, and a single point of making a complaint if the member's needs are not met. Yes. So part of what we are looking at when we're looking at the grievance and dispute process is a lot of what is currently within regulations and how do we increase language to be a little bit more clear about our expectations. We talk a lot about person-centered language in service plans and what type of support is being communicated and how is that support being maintained. Part of that whole process may be indicating in further detail that prior to an individual being in a home or receiving services from a host home provider, if they are requiring additional training to meet the needs of the members, we are setting a timeline on that and we are making sure that that is happening so that when the individual does enter the home, or if they're in the home and they're requiring this new additional training or new line of support, that those needs are being met and those training requirements are being fulfilled within a expedited amount of time to ensure quick response for the support needed for the member. As far as the single point of making a complaint if a member's needs are not being met, this was part of the research that Mission Analytics did. What door do you enter to provide this type of feedback as far as a complaint or a grievance? And with that, if you are making a complaint to law enforcement, what does that look like? What areas do they reach? And then what are the responsibilities from there? Catherine, are you able to give us kind of a little bit of a snapshot? Potentially, you might have your doorway snapshot that you might be able to share, or just give us some information about what your findings were as far as the right door to access for making complaints that meet the needs of the member.
It looks like there's a lot of, I could probably address some basic questions on this. It looks like there are some easy ways for individuals and family members to access doorways. And it depends on what, again, their questions are. But I think that there are places they can go. And a lot of members, I think, would just need to be, I think it might be a little more clear at some point. We are working towards finding that information. That's what the stakeholders groups are about as well, is to exactly what might be helpful for them to gain access to those informational sets as well. So that's kind of where we are at this point.
Okay, thank you.
Mm-hmm.
I'm seeing quite a few comments in here about the due process and rights of clients. Specifically, Julie had stated, please also consider the due process rights of clients to be fully integrated in community and live in abuse-free home and get services and supports identified and covered by the tax-free rate paid on their behalf. I agree. Yes, that is one of the things that's first and foremost in our mind when we are evaluating these processes. Although the language being presented may seem very provider-centered, please be aware that we are addressing each of these situations and each of these goals with the member in our forefront of the mind. We are making sure that first we are considering the member and how to best support them. If that means that we need to increase regulations or more clearly define regulations, we're putting a lot of that responsibility on the providers and the provider agencies, as they are not identified as the adults at risk. We want to make sure that we are providing the best possible support for the members that we serve. Christina, anything that applies to host home providers should also apply to PASAs. There needs to be a way to evaluate agencies. Yes, currently there is a process through CDPHE to evaluate agencies, as well as HCPF also maintains a pulse on what is going on with agencies and works in collaboration with CDPHE to make sure that we are mitigating any issues that we see that are potentially going against the regulations, creating unsafe environments, and leading to additional or more destructive behavior from both PASAs and providers. So the PASAs are being looked at equally in this situation as far as what we are holding them accountable for and their responsibilities, and how do we stop potentially unethical behaviors within PASAs from continuing as well. Julie, agree accountability needs to be system-wide, but specifics of host home providers are different from specifics of PASAs. That is correct. Deanne, I agree with Julie's statements on the due process of clients in these host homes. I would like our conversations to be balanced with the rights of clients being first and foremost. Regarding the database, it can only be as helpful as information entered. I'd like to hear about who will verify that the data is being entered. What oversight will HCPF be responsible for? What action will HCPF take if data is not being entered? Laura, you were absolutely correct. The information that we receive is really based on the information that people are providing. So we do have current policies in place as to what that communication is supposed to look like currently. Unfortunately, it does take a lot of outreach on the department currently, especially with the Department of Local Affairs, to verify that information and to really pull that information from providers. Unfortunately, not all provider agencies have us at the top of their list for communicating information. And it is often that we need to do quite a bit of follow-up. So how do we shore up that process and make it clearer the expectation that HCPF has for the communication of that information? All right. Kathy, it seems like most of this process is dedicated to punitive measures, and those are certainly warranted in abuse cases. I think we could also ask for regular frequent training, a requirement basically for continuing education, also rewards for great service. Do we honor anyone for their service? This is a tough job. Yes, part of one of the things that we have considered with the database and with that rating system is really, in a way, how do we elevate those good providers? We know that they are the vast majority of the providers that we have in Colorado, those that are in it for the right reasons. They are wanting to better themselves through continued education and training. How do we highlight their experience and their dedication? With the provider rating system, there is an opportunity for us to do this. There are always ways that we can increase this and really highlight those providers. But one of the conversations that we've had with the database is if there is a provider agency or a case management agency that is looking for a suitable provider for one of their members that they serve, this database, would it be able to be a searchable database that says, these are the check marks of what I am looking for in a provider? And then they would be able to look at a list of providers that meet their qualifications, that have high ratings, that really kind of that show that they are considered quality and reputable providers. So that is not lost on us during this process. Pat had mentioned, I agree with others who have raised questions about the quality of life for people living in host homes. What needs to be done to make sure the individual is bathing, having nutritional needs met, has adequate clothing and shoes, is getting out of the house and doing activities that they want to do, is able to have friends, able to go to church if desired, etc. So we do monitor those, as well as this is a big aspect of the monitoring of CDPHE and what was implemented through the final settings. And so those are definitely things that we look at, and we can always look at potentially increasing our expectations and the language defining those expectations within regulations. HCPWF should be responsible for developing templates for host home providers. The contracts between the PASA and the host home providers should also be transparent, publicly available, and easily accessible. Thank you, Renee. I appreciate your feedback. That is exactly what we're trying to seek, whether or not those types of standardized templates would be beneficial. One of the work groups was discussing CDPHE oversight of current regulations. Can we get an update on that work? What has been discussed and what is being discussed to change in the future? Do I have a work group member that would like to speak on this? Okay, I'm hearing a lot of silence. So what I can tell you as far as those conversations is that the conversations with CDPHE go a little bit deeper with HCPWF than just this project alone. In the last couple of years, there has been a lot of conversation about how can we increase the efficiency of audits with CDPHE, and what are we looking for, and how do we make sure that those audits are being completed in an efficient way and a thorough manner. So that is not lost in this project. We are continuing to work with them. Those conversations are well underway, but unfortunately, that's as much of an update as I can give you right now. There are lots of discussions about how those things can change, and we continue with those conversations. Who has Mission Analytics been engaged with as they develop their recommendations? Have they been talking directly with residents in host homes? If so, how many residents have they spoken with directly? How many family members of residents have they spoken with? Catherine, would you mind taking this one?
Sure. Yes, we've had 2 focus groups so far with individuals and family members. The first one we had about 4 people. One was a support person for one of the individual residents living in a care facility and then in a host home. And the second meeting was with 2 host home individuals. So, and then we had a separate meeting as well with an individual who wanted a more in-depth conversation. So that's where we are right now. We had lots and lots of good conversation.
Thank you. Okay, I know we only have a few minutes left, and I do have one more slide. So I would like to go to this next slide. Again, we will be continuing with these conversations. We will be sharing this slideshow as well on the applicable website, and we'll get that out. And we'll be following up with the comments and questions that have been put in the chat. One of the things that we will also be sending out, and I will put the link directly into the chat as well. I know it's not great in here. However, we are asking, if you have the opportunity, please consider completing a survey regarding today's meeting. This survey does kind of capture what are your thoughts on the process? Have we addressed these goals appropriately as far as the 3 goals set forth with the host home provider bill, and what your feedback is. Your feedback is critical to the progress of this project. And moving forward, the purpose of this project is, or this House bill, is really fact finding, information finding. How can we shore up this information? HICPUF and the team that is associated with this project is required to present to the General Assembly by January of next year a finding of, or a report of our findings that we have touched on these 3 goals and how do we plan on moving forward. So we will begin the process of developing that report in the beginning of October so that it is ready for January. We hope to wrap up the information seeking aspect of this and our contract with Mission by the end of September. So I will get this link right into the chat. Please, again, consider filling out this survey. And I will stay on for a few more minutes just to make sure. If you have any additional questions or comments that you'd like to put into the chat, please, oh, sorry, one moment. Again, if you have any additional comments or questions, please put them in the chat so that we can make sure that we follow up with them and we are addressing your concerns. And I will put this right into the chat. Just one moment. I was putting in the wrong link. There is the link to the chat. And again, we will also be sharing, I'll put into the chat as well, the slideshow for today. Okay, if you have additional questions, comments, or if there are any difficulties you have with those links provided, you can always reach out to me. Again, my name is Maggie Yanaba. I am the HCBS Benefits Supervisor here overseeing this project. And Grant Reefer, he is my HCBS Benefits Specialist who is assisting me with this project. We thank you all for your time. We are at time today. So again, I will stay on a few minutes just to make sure that if there are any additional questions, please put those into the chat so we can capture those. Otherwise, have a wonderful day. Thank you.
Meg, do you mind if I ask a question real quick?
Sorry, go ahead.
Yeah, thanks. I was just curious if anyone could speak to like next steps of continuing work. I know that was an outstanding question there. Like what comes next after this meeting?
Yes, thank you. So currently we don't have any additional meetings following up with this scheduled. However, that is something that we are going to be looking at doing just to kind of cap off the work groups, as well as if there are additional questions, comments, concerns that we want to follow up on with the stakeholders. We will look at whether or not another stakeholder meeting will be appropriate, or depending on the amount of information, if a follow-up publication or email would be sufficient. So we will be looking at those types of things. And it is a question within the survey whether or not stakeholders would like to have another meeting just to kind of round off this project.
Mm-hmm. Okay. And then just relating to some of the comments about people with lived experience kind of having limited access to share their stories or their experience or their thoughts on these policies that might really affect their lives. How is the department considering how to recruit more people to participate in this type of work? Is there something that in like a John Barry notice can be used as a sign-up link to recruit more people to participate in this work?
That's definitely something that we can look at. When we had the initial stakeholder meetings for this topic, as we're all aware, it's a very hot topic. And so there was a lot of voices. That's why we developed the work groups to be kind of intake representatives for members to be able to communicate specifically with the work group members that are researching these situations. We use that as kind of a way to filter and just consolidate the process. I do have the contact information for the work group members that act as representatives. You can reach out to them, or if you would like to speak with me directly regarding your lived experience, I would be happy to set up time or field any emails, any comments, things like that. So you can always reach out to me with those, but we can look at evaluating that process for future meetings as well.
Mm-hmm. Yeah, I think the comment here is valid, you know, that there's not somebody with lived experience in each of one of those work groups. So their voice really isn't present at that table.
I do appreciate that. Part of one of our first surveys was asking for interest in participating in these types of work groups. I know that there's been a lot of interest in this topic. Unfortunately, when it came to regular attendance in work group meetings and participation in that sense, there wasn't a wide variety that are touching all stakeholders. So we tried to capture that as much as possible, and I know Mission has done quite a bit to try and capture that as well. So again, if there are stakeholders, anybody that's on this call or anybody that you have heard from that would like to grab my ear on this topic and provide their input, I am very, very willing to have those conversations.
Okay, thanks, Meg.
Thank you. Okay, thank you, everyone. I hope you have a wonderful rest of your day. And we look forward to reading your comments and following up. Have a good one.